Where is my mind? Where is my mind? Where is mine?
Hi, abnormal psychology students. Today we're going to talk about eating disorders. And in many training programs and counseling centers, eating disorders are considered a very special and severe disorder. And those who treat eating disorders tend to make this their specialty or their area of expertise. And for this reason, I was actually hesitant to work with clients with eating disorders, fearing that they would actually recover more quickly if they were with one of these specialists. My experience, therefore, is somewhat limited. Though, much like with trauma, it's actually difficult to work with the general population of women without encountering disordered eating behaviors at some point. The National Association of Anorexia Nervosa and Associated Disorders estimates that between 85 and 95% of those diagnosed with anorexia or bulimia are women. So that leaves only 5 to 15% of diagnoses to men. So not surprising, the case that I'm going to discuss today is my work with a 19-year-old female who was white, heterosexual, and in college. She presented to therapy because she was distressed by her binging and purging behavior, and she wanted to stop these. She reported that she began dieting when she was 7 years old, and she began experimenting with purging when she was 12. She stated that her mom normalized these behaviors, saying that it's okay to throw up if you feel like you've eaten too much. And she stated that the frequency of her binging and purging had varied throughout the years, and that she was currently purging by way of vomiting approximately 4 times a day, and she was binging about once every 3 days. So when she described a binge, she reported feeling totally out of control and like she lost time. She didn't actually know how long she'd spend binging on food. She stated that her binges happened late at night when her roommates were asleep, and she would store food in her room for the 1, 2, or 3 days leading up to a binge. She would save this for a binge. Her self-induced vomiting was sometimes connected to a binge, though she purged more often than she did binge. And she said that she purged in response to a lot of different feelings. All of them were reportedly uncomfortable to her. And as we processed through these feelings, it became clear that she actually had a hard time distinguishing between different emotional states. So she purged when she felt bad, but couldn't really describe what that bad feeling was, so she couldn't come up with alternate coping strategies for those feelings. She reported that she always felt like she either had a rock or tree roots in her stomach. That was really the source of the bad feeling. And this difficulty with emotions and even that distorted physical sensation located in the stomach, it does often accompany eating disorders. So as our work continued, we really engaged in psychoeducation about emotions as well as deep emotional processing to help her build an emotional vocabulary and coping skills that were more effective than her current disordered eating behavior. We eventually discovered that she did binge when she felt bored, anxious, worthless, and overwhelmed. At the beginning of our work, all of those feelings were actually one and the same to her. Our treatment had 2 main foci. The first was this emotional processing and corrective experiences surrounding these feelings. So this is an interpersonal approach, and it has been found to be quite effective with eating disorders. Interestingly, this approach really doesn't target eating behavior at all. I actually remember learning about this as an undergraduate myself and feeling really flabbergasted that a therapy could be effective for eating disorders and not deal with food or not talk about how to stop binging and purging. So what the interpersonal approach looks to is actually the antecedents to the disordered eating behavior. So if we can address those antecedents, and in my client's case, those were some of those uncomfortable feelings as she described, so feeling worthless or feeling really anxious, then we'd be able to develop alternative strategies for managing those feelings, and the eating disorder symptoms should go away. That's the interpersonal approach. Now, we did have a second focus, which did look at the eating behavior specifically. So this was all about repairing her relationship with food. So my client had 7 years of consistent binging and purging, and this had really warped her ideas of food. To her, any food item was judged on how quickly it could be eaten and how easily it could be vomited back up. That was her criteria for why she might eat something or why she might save it for a binge. She did not think about food in terms of flavor. She didn't think about it as nutrition. She didn't experience it as pleasure, and so she really didn't evaluate it based on those criteria. She also deeply mistrusted herself around food. So she thought that if she let herself eat the kinds of things that she tended to binge on, so if she was allowed to eat those anytime, then she would be fat. And she really did have a fear of being fat. So this resulted in a cycle that she got into of some food restriction where she had off-limit kinds of food. And then after those 3 days passed of restriction, she would then binge on most often the food that she was denying herself. So to address this relationship, we focused on what is called intuitive eating. This is a model that was developed by nutritionists. Their last names are Tribal and Resch. There are 10 principles in this intuitive eating model, which you can learn way more about if you go ahead and Google intuitive eating. The radical ideas, so the radical principles for my client, were that she could eat what she wanted whenever she wanted, and that there's really no food police. This is the idea of making peace with food. So this is the notion that if we really listen to our bodies, both what our bodies need for sustenance, but also what our taste buds want to taste, and then we let ourselves eat, this is my cat, let ourselves eat those foods, then we're going to feel satisfied. We actually won't need to binge, or we won't need to continue eating the food if we are really honing in onto what our craving is. So that urge to either binge or overindulge really comes about by way of restriction. So what my client and I did to try to honor this idea that no food is off limits is we slowly took foods off of her bad foods list, so the things that she would never let herself eat outside of a binge. We said, you know what, you can eat as much as you want. You could eat this all day, every day, if you want. So we're really trying to radically change her relationship to food. She was petrified. She was so worried that if she truly allowed herself, that she would never stop eating. Well, what she found was that when food wasn't forbidden, it wasn't that tempting. She didn't have the desire to binge on it or save it up because she had satisfied her craving or her desire, both her energetic craving but also her sensual craving for food that tastes really good or food that gives her a pleasant experience. The food police is that second radical idea that I mentioned, and the idea of food police is all that self-talk that we do regarding food. So it's the self-talk that we say to ourselves, oh, I was really bad today because I ate X, Y, or Z, or I was really good today because I restricted some of what I ate. That's the food police. It's determining that you are good or bad or worthy or worthless based on what we eat. And really, those kinds of thoughts have no place in an intuitive eating model or in a really respectful eating model, or one where we're respecting our bodies. So the food police needs to be silenced. And what my client worked on was to first become aware of this self-talk, become aware of what the food police said to her in her own mind, and especially what it was saying in conjunction with her emotional states, because these often went together. She would feel like she was really bad, or she'd be feeling very anxious, and then the food police would jump in, maybe suggesting reasons why she was so anxious because she had been so bad with her food. So silencing the food police for her really had a lot to do with meeting her other psychological needs. She and I met in individual therapy, and during our work in individual therapy, she also participated in a psychoeducational group that was focused on body acceptance and used the health at every size model. So this is a model of body image acceptance and eating disorder recovery that doesn't really focus on weight, focus on size at all. It's really looking at health at all the different sizes our bodies can be. So at termination, after 23 individual sessions, I'm happy to say that my client did report that she hadn't binged or purged in over 1 month. Now, eating disorders are sometimes considered similar to addictions. There's actually some researchers who are looking at a grand theory of addiction, including eating disordered behavior. And the reason why I say this is because most people find that their recovery from an eating disorder is quite lifelong. So people need to work recovery in the same way that people often say they need to work their recovery when they're in recovery from a substance abuse or a substance dependence. So after 1 month of abstaining and really working to change her coping skills, that's quite successful. And likely she is, well, I hope that she is continuing to work that recovery even all these years later. Thanks for listening.